Hello and good morning. Today we will be discussing about the COVID-19 timeline and management. COVID-19 timeline concept is very important to manage the COVID patient. You have to, if you are aware of the COVID-19 this timeline, then we can manage 80 to 85% of the people at home only. So that is very important. Let's begin the timeline. Since when you get exposed to someone, and if you get exposed to someone, the virus will enter inside your body, and from the day the virus enters inside your body and the first symptom begins is the period that is known as the incubation period. So the first time the virus get exposed and then it enters inside your body and then first symptom develops, then that is in this period you are totally fine, you don't have any problem, and that is incubation period. Now the first symptom that develop is very important to address, because to note down, because the first symptom develop and from that 3 to 5 days or 6 days the symptoms will be disappear and you will improve without any consequences, and you are now corona warrior. So you are getting improved only in just from the day of the first symptoms. In 5 or 6 days you will be totally improved, and there can be a mild myalgia or say chest congestion, but if you are not deteriorating, then you will be improved in 5 days and you will be going home as a corona warrior, as a corona improvement patient. So let's see about this timeline and why it is important. But if you have developed this first symptoms like sore throat, irritation in the throat, cough, fever, headache, myalgia, whole body ache, and in some patient diarrhea, in that patient the first symptoms in 5 days, if you are not improving, if your symptoms are getting worse, then it indicates that you are going to a danger turn, you are going to a serious condition, you are going from mild disease to the moderate and severe condition. So that is the important for the timeline to note down the first symptoms. Initially, in the initial outbreak, in the primary wave, what was the problem that we used to evaluate, which is the incubation period. We used to know that, okay, I got virus infected from my friend or family or from this party. But this in second wave, the surge is so huge that it is in the community spread has already occurred. So we cannot determine where we have get this virus. So at least we should note down the first symptom, day of the first symptom. If the day of the first symptom, if you develop any of the symptoms like sore throat, irritation, cough, fever, myalgia, headache and diarrhea, then you have to understand that, okay, this is my first day of my first symptom and I have to check my 5 days. If I am improving, then I am going to a curve of improvement, and that belongs to the 80 to 85% of the people. So among 100 people, 80 and 85 are going to improve without any treatment, without any support, without anything. Just mild symptomatic treatment will be enough. Then coming to the 5th or 6th days, if you are not improving, rather you will develop the warning sign. What are the warning signs? The warning signs are like new onset of fever, previous fever that become high grade, and hacking cough. If you are developing these things, like if you have no fevers, you have other symptoms but develop now high grade fever. If you have fever but that becomes high grade, that has increased in intensity or its grade, it has now become 101, 102, then you have to understand that your symptoms are getting worse. And if you are developing the hacking cough, then that's cough it's like inside the due to congestion you are having this problem. You have to understand, once the virus enters inside your throat, it enters inside the cell. There is the AC receptor, and virus has the spike protein that goes inside the cell. The more AC receptor at the lower part of the lungs, but it inside it becomes replicating, and then the body immune system get kicking. It tries to clear out, and in this first day, when there is a fight between the virus and your immune system, then there is a release of these chemicals known as the cytokines, and this first day of symptoms develop. The fight continues, and when your body wins, then you goes to the improvement cycle and everything is okay. But if your body doesn't able to control the virus, there are the large number of antibodies producing. The body wants to control the virus. It will producing the antibody. The antibody that they have produced, the body has produced to fight against the virus, if they found that similar structure that of the virus into the blood vessel, normally into the lungs, and then attack their own blood vessel. So due to this fight, this immune reaction, now this antibody is going to damage our own blood vessel, and that leads to the rough surface of the blood vessel, leading into the coagulation inside our body. And if you are not going to give anything that control the coagulation, then blood will clot, and there will be a blockage, and there will no blood supply. And since we are inspiring the air, the oxygen from the air, that needs to be carried by the blood that comes to the lung. If there is no blood in the lungs, then what happens? Now the oxygen saturation will be deteriorate slowly and slowly, and there will be need of the oxygen. And at that time, if you are not providing the oxygen, and that inflammation reaction, if you are not giving the steroids, and if you are not giving the anticoagulant, now the patient is going on the ventilator or going to die. So these three things, what is the mechanism? If you understand the pathophysiology, that is easy to deal with this disease. What are the things going on due to the dangerous turn? On 5th or 6th day, you are saying that patient is developing this new onset fever, previous fever that become high grade of warts and hacking cough. And why this is occurring? Because there will be the fight between the antibody has again now attacking your own blood vessels into the lungs, and that because of that there is a blockage and there is no blood supply. So you need to manage this whole thing. Since there is a drop in oxygen, you need to give oxygen. If you see the moderate management, we'll talk in detail. Then there is we'll supply the oxygen. Then since to reduce the inflammation, we give the steroid, and to prevent the blood clotting, we give the anticoagulant. And this is only the treatment established for COVID-19. If you are giving this treatment, your patient is going to survive, but it is new to intervene early. That is my important point. Now there will be the position that you have to understand that at this stage you need to give this steroid and anticoagulant, but never and never you give the steroids on their first day of symptoms. Why? Because you know the virus has entered inside your body. It is replicating now, and then the body has a chance. Remember, any drug is not going to eliminate the virus. Your own immune system is going to eliminate the virus. And if you are giving steroid on the first day, that is going to suppress your immunity, and then virus will take the upper hand, and again you will go into the dangerous storm. So body will never get a chance to recover, and the patient in 80 to 85% which is recovering by own, you will suppressing, and this patient will come into the dangerous storm. So never ever give the steroid on the first day. At least no steroid that is parenteral or oral. It's local inhalation can be okay because that is not absorbed into your systemic circulation. But parenteral steroid not oral or systemic steroid should not be given on this day. It should be given only if there is a dangerous storm. If there is the 5th or 6th day, if there is a warning signs are developing, if the body immune reaction has triggered very badly. Okay, so that is the important point. You should always give steroid if there is a dangerous turn or dangerous turn to prevent the patient from the severe COVID-19 or from the catastrophic outcome. Okay, there is another need of this coagulation is going on, so anticoagulant should be given. That is very clear, because if you are not going to give anticoagulant, then what is going to happen? Blood is going to clot, and now whatever oxygen flow you are giving 16 liter, 18 liter, doesn't work. 15 liter, even if you can intubate, if there is no blood supply. If the blood supply is not going and taking the oxygen, there will no increase in the saturation. So anticoagulants is must at that point also. Okay, so looking at this timeline, there is another timeline that is need to do, that once you start the steroid on the 5th or 6th day, on 4th day, that is you can say 10th or 11th day, what happened? There will be development of new fever. And because why it has been developed? Because you have now given the steroid, and after steroid, their own blood, your own flora will going to cause you pneumonia. Due to the aspiration, there will develop the pneumonia, and that is not due to the viral, it is a bacterial cause. And at that point of time, you need to give the antibiotics. You should never start antibiotics on the first day. It should be given on the 10th or 11th day if the patient is not immune. If the patient has gone to the improvement curve, there is no need of antibiotic at all. If there is going into the dangerous storm, at that time of point, you are going to start the steroid, and due to steroid, the immune suppression has shut down. There is no immune backup, and because of that, your own bacteria, your own flora is going to cause you. And if you are in the hospital bugs will going to cause you pneumonia. And at that time, the role of this antibiotic, as you are giving azithromycin or doxycycline, that comes into the play. That is important at that point. Okay, now let's you have understood the timeline. If you understood the timeline, you will able to manage your patient at your home. Like mild, you can manage it at the home isolation. In moderate and severe, in moderate you can manage in the ward. In severe, you need to give into the ICU. Let's talk in detail about the management. If there is the mild symptoms from here to here, the respiratory tract symptoms without shortness of breath and hypoxia, since there is a respiratory oxygen saturation more than 94, you don't have to do anything. You keep in the home isolation. Symptomatic management: if there is a fever, give paracetamol. If there is cough, give the cough syrup. If there is allergy or irritation, give anti-allergic. Vitamin supplement. Vitamin supplement is important in Southeast Asia or any part of the world. The people are not taking adequate food and they are not getting balanced diet. It is not for the COVID, but it is for your own supplement, as we need the immune backup very nicely. So vitamin supplement can be given. It won't going to be harm, but you should take into consultation of doctor because you not need to take higher amount. Higher dose may develop into the toxicity. So adequate amount of vitamin supplement can be taken with the consultation of the doctor. Then you if the symptoms are not improving at all, like irritation and cough and fever is persisting, then at that time inhalation budesonide, this is the steroid. But remember, I have said no systemic steroid. This local steroid might be given. It has only into the local application. It doesn't go into systemic circulation. It doesn't suppress your immune system. So that can be okay, and that actually improve. It will help you a little bit. Okay. Now coming to the patient who developed the respiratory rate greater than 24 per minute or developed saturation that decreased to between the 90 to 93. If it is below 90, it goes into the severe COVID-19. But if it is the 90 to 93, we have to understand it is the moderate COVID-19, and that's a case you need to give the oxygen supplementation with the target maintaining at 90 to 96 degree. You need to prone the patient. You need to prone out the patient with admission into the ward. Okay. Now you need to give the steroids because you need to stop that inflammatory reaction. Steroids is the highly potent anti-inflammatory agent. That may be dexamethasone 0.1 to 0.2 milligram per kg per day. You can give in divided dose. Even injection methylprednisolone can be given 0.5 to 1 milligram per kg in 2 divided dose. Even oral prednisone can be given. What steroids you have, you can give the patient. Okay. Now another is anticoagulants. Anticoagulants can be low molecular or high molecular heparin. The heparin can be given. So you can give the safest is the low molecular weight heparin, that is enoxaparin, which can be given 0.5 milligram per kg per day OD for subcutaneously. It can be given for the 3 weeks, and the steroid can be given for around 10 days. That you have to remember. The 3 weeks is necessary because there is a tendency of coagulation remaining. So there will be the prolonged anticoagulation treatment, and that's a single dose, but the steroids should be tapered or should be stopped at around 10 days. Then there is the experimental drug. If you are in the early phase, if you are in replicating phase, this remdesivir will work. It will inhibit the replication. But remember, if the viremic phase has gone, if the replication phase has been gone, there will be not much role of this remdesivir. And because of that, there are many publications in the big journals having no effect of remdesivir in the mortality. There is another drug like tocilizumab, and that can be also be given to the patient if patient is moderate or severe COVID-19. Now coming to the severe one, anyone who have respiratory rate greater than 30 per minute and its SpO2 less than 90, if saturation dropped less than 90, if you are measuring your oxygen level with your probe oximeter and you are finding that there is a less oxygen than 90, you have to hurry. You have to get your patient admitted into the ICU. There will need of the high respiratory intervention, like you need to give the NIV, or you need to give the CPAP, BiPAP, or even intubation will be required depending upon the situation. Then this also the oxygen support will be there. Steroids you need to be continue, or you need to give if you have not been given previously. Anticoagulants to be given. Even other supportive measures like you need to maintain the AVC, maintain your hydration, maintain the fluid balance, maintain the electrolyte balance, see the blood pressure should not be dropping down. If there is a sepsis, manage sepsis with the sepsis protocol, give antibiotics. Remember, I have told you on the start of the steroid and the 4th day there will be the pneumonia, and that will be the bacterial, not the viral one. So at that point antibiotic roles may come. So you have to get that point antibiotics. If you are not giving, then patient will die due to the bacterial pneumonia. So that you have to know very carefully. So in a nutshell, and there is one point of this proning. Look, proning is a situation where you sleep in your stomach, in your this part of the body. So when you are lying down back, no, you are lying on the front lying, what will happen? That look, your upper part in the front there is a heart. Heart is major part. Heart is there, and there because of that there is a less lung in the front of the chest. In the back of the chest, whole back is totally lungs is exposed. If you are giving in your prone position, how is prone you will maintain? You will put a one pillow in your upper chest over here, then 2 or 3 pillow in the waist. So there will be this gap between the surface and your stomach, so you can just breathe freely, and there will be another pillow in your legs. And because of that, your back of the lungs get exposed. The alveoli get to clear off, the reserve lung get activated, and there will be increase in the saturation in 5 to 10% with the room air. So you need not give to, if there are no oxygen with you, what will be the next plan? you do the proning. Proning is a established mechanism of improving the oxygenation. You might not able to sit in this position for it will not improve in 5 minutes. It will take around 30 minutes. So 30 minutes to 2 hours you sit in this position, then you goes to the right side and goes to the left side. The least oxygen is taken on the lying back. So avoid the back. If you have no other complication like heart disease or something, you can lie in the proning position on the right lateral or left lateral position. That will improve your oxygenation. Okay. So in a nutshell, the important, with this understanding, you can manage your COVID-19 patient 80 to 85% within the home without any further complication. There will only 5 to 15% that needs to the hospitalization, that goes to the dangerous turn and they need in the hospital. But even into 5 and 15%, if you are able to give timely this steroid and anticoagulants, then if except 1%, everybody will be survive. Everybody will go home as a corona warrior. If you are not able to give this steroid and anticoagulant at this point of time, then there will be the more increase in the death rate. So with this understanding, I hope we will able to manage our patient, COVID-19 patient, easily around the world, in any part of the world, and hope we'll save more people, which we know this COVID-19 is a preventable disease. The death can be prevented, and we all should put our effort to prevent the life in any part of the world. Thank you and namaste.